Thank you very much, Mr. Speaker. My apologies. I've lost my voice slightly. I was at Wembley on Sunday night, and I have to say those young Lions outperformed, and we are so proud of them. And I am certain that in 15 months' time, the nation will get behind them in Qatar, and they will outperform again. I'd like to thank the honourable member for raising this really important question. We are committed to protecting vulnerable children and ensuring that every child receives the best start in life.
Let's go to Afzal Khan. Afzal.
Thank you, Mr. Speaker. Children and young people's health was severely impacted by the pandemic. However, it is the mental health impact of lockdown and school closures that is perhaps the most concerning. 12% of inpatient pediatric beds are now occupied by those admitted due to severe mental health problems, double what it was in 2019. Does the Minister agree that children and young people have suffered greatly as a result of lockdown and their health should now be prioritised in our recovery? If so, what steps will he take to put children at the heart of all policies and implement an overarching child health strategy?
I'm grateful for the honourable member's question. Mental Health Recovery Action Plan, Mr. Speaker, will allow us to deliver that additional support to 22,500 more children to have access to community health services. I know that the Mental Health Minister would say that community access is incredibly effective. 2,000 more children to access eating disorder services, help increase the coverage of mental health support teams in schools and colleges from 29 to 400 by April of 2023. And all the more important to the member's question, as Secretary of State has already outlined, that getting to that step 4 is critical to be able to deliver this recovery action plan.
Late. Yes, sir.
Thank you very much, Mr. Speaker. Whilst the Department of Health and Social Care takes a keen interest in any tax situation which may affect patients, any discussions surrounding the VAT treatment of patient transport services would need to be conducted with relevant officials within HM Revenue and Customs, Mr. Speaker. Services of the transportation of the sick and injured are exempt from VAT.
Ben Lake.
Mr. Speaker. Non-emergency patient transport services provide vital support to those who have no other way of reaching hospital and medical appointments, in addition to those who require specialist transport. Now, currently, an inconsistency in the VAT treatment of these providers means that some providers can claim VAT relief whilst others cannot, despite the fact that they provide the same services in the same type of vehicles. Would the Minister consider meeting with representatives of the sector to better understand the impact this is having and perhaps hopefully to find a way forward on this issue?
I'm very happy for myself and, of course, my fellow Minister to meet with others. Of course, I cannot comment on specific cases and would recommend that the services in question take up, obviously, their concerns with HMRC as well.
Margaret Farr.
Question 26, Mr. Speaker.
Thank you very much, Mr. Speaker, and can I thank the Honourable Lady for her question. We're working with the United States authorities, with the EU and other international partners to ensure safe return to international travel whilst managing public health risks. We support a global, consistent minimum technical standard for COVID status certification. Of course, the NHS app and the NHS COVID pass is now accepted in 33 countries around the world.
Thank you, Mr. Speaker. The continued lack of recognition of vaccination status between the UK and the EU is putting the UK at a competitive disadvantage, according to ABTA, especially compared to the steps taken by the EU and the US. Both the UK and the EU now have standardised digital ways to prove vaccination status. So will the Minister clarify why there is an ongoing delay in resolving this matter?
I'm grateful to the Honourable Lady. The EMA and the MHRA, our regulator, work incredibly closely together, and the EMA has authorised the vaccines that are approved by the MHRA. All vaccines that are authorised and deployed in the UK have been subject to rigorous checks, including, of course, individual batch testing and site inspection. We work very closely. Our two regulators work incredibly closely together, and that I am confident we will continue to do so and make sure that if there are any issues, they're resolved as quickly as possible, working with the manufacturers as well.